Hi. Welcome to the Professional Certifications channel. In this video, we will explore common questions asked by JCI surveyors and provide answers on the access to care and continuity of care, ACC. Who evaluate patients' readiness for discharge? The evaluation of a patient's readiness for discharge is a collaborative process involving multiple healthcare professionals. The goal is to ensure that the patient is medically stable, that their care needs can be adequately met after discharge, and that they have a clear plan for follow-up care. Here's an overview of who is involved in evaluating a patient's readiness for discharge. 1. Attending physician or primary care provider. Role: the attending physician or the primary care provider overseeing the patient's care has the primary responsibility for determining whether the patient is medically ready for discharge. This includes assessing the resolution of the acute condition, stability of vital signs, and overall health status. Tasks: review of clinical progress and response to treatment. Assessment of whether the patient has met the medical goals for discharge. Determination if further inpatient care is no longer necessary. Writing discharge orders, including prescriptions for medications and instructions for follow-up care. 2. Nursing staff. Role: nurses play a critical role in assessing the patient's readiness for discharge by evaluating their ability to manage daily activities, adherence to the care plan, and understanding of discharge instructions. Tasks: assessment of the patient's mobility, self-care abilities, and pain management. Evaluation of the patient's understanding of their medication regimen and ability to take medications as prescribed. Reinforcement of discharge instructions, including wound care, diet, and activity restrictions. Identification of any barriers to safe discharge, such as home environment concerns or need for additional support. 3. Case manager or discharge planner. Role: case managers or discharge planners coordinate the discharge process, ensuring that the patient's transition from hospital to home or another care setting is safe and smooth. Tasks: coordination of post-discharge services, such as home health care, physical therapy, or durable medical equipment. Assessment of the patient's social and financial resources, including insurance coverage and support systems. Arranging for transportation and ensuring that the patient has access to necessary medications and supplies after discharge. Communicating with community resources, such as outpatient clinics, long-term care facilities, or rehabilitation centers. 4. Pharmacist. Role: the pharmacist evaluates the patient's medication regimen to ensure that it is safe and appropriate for discharge. Tasks: review of prescribed medications for potential drug interactions or side effects. Ensuring that the patient understands how to take their medications correctly. Providing education on new medications prescribed at discharge. Coordinating with the pharmacy to ensure that the patient has an adequate supply of medications upon discharge. 5. Physical therapist, occupational therapist, or other specialists. Role: depending on the patient's condition, physical therapists, occupational therapists, or other specialists may be involved in assessing the patient's readiness to return home and their ability to function safely in their environment. Tasks: assessment of the patient's mobility, strength, and ability to perform activities of daily living, ADLs. Recommendation of assistive devices or home modifications to ensure safety. Training the patient on exercises or techniques to maintain independence. Coordination with the case manager for ongoing therapy needs post-discharge. 6. Social worker. Role: social workers assess and address any psychosocial factors that could impact the patient's readiness for discharge. Tasks: evaluation of the patient's support system, including family and caregivers. Identification of any mental health or substance abuse issues that need to be addressed before discharge. Assistance with accessing community resources and support services. Providing counseling or support for the patient and family in managing the transition from hospital to home. 7. Patient and family/caregivers. Role: the patient, along with their family or caregivers, plays a vital role in determining readiness for discharge by providing input on their ability to manage at home. Tasks: expressing concerns or preferences about discharge timing and plans. Providing feedback on their understanding of the discharge instructions and ability to follow the care plan. Planning for follow-up care and ensuring that they can adhere to prescribed medications, appointments, and lifestyle modifications. Discharge Readiness Checklist. To evaluate discharge readiness, the healthcare team typically uses a checklist that may include the following. 1. Clinical stability. Patient's condition is stable, with no need for further acute care. 2. Mobility and self-care. Patient can safely move and care for themselves or has the necessary support to do so. 3. Medication management. Patient understands their medications and can take them correctly. 4. Follow-up care. Clear plan in place for follow-up appointments and any necessary post-discharge care. 5. Home environment. Patient's home environment is safe, where necessary modifications/supports are in place. 6. Patient and family understanding. Patient and family understand the discharge instructions and are competent in managing care at home. Conclusion. By collaborating across these various roles, the healthcare team can ensure a comprehensive evaluation of the patient's readiness for discharge, promoting safety and continuity of care after the patient leaves the hospital.